Have you ever looked at a medical bill and just felt completely lost? Duplicate charges, confusing fees, insurance jargon. It is frustrating for everyone involved. Now, imagine if your medical bill was not just a piece of paper or a PDF, but a secure digital asset that you actually owned and controlled. Something transparent, tamper-proof, and easy to verify. Sounds like science fiction, right? But this is exactly what non-fungible tokens, yes, the same technology behind digital art, could do for healthcare payments. It is exciting, but it is not a magic fix. It requires thoughtful planning, clear communication, and a willingness to rethink how we have always done things. So how do we make this work? First, it is important to start small. Testing non-fungible tokens on a limited scale lets us identify issues early and keep patient data safe. Next, we have to keep things simple for patients. If people do not understand the technology, it just becomes another hurdle. Explaining non-fungible tokens in plain language is crucial. We also need to question the so-called best practices in healthcare billing, because sometimes those practices are just what is easiest, not what is best for patients. Using smart contracts to automate payments is promising, but only if we thoroughly test to avoid mistakes. Finally, privacy and compliance with laws like the Health Insurance Portability and Accountability Act must always be top priorities. Innovation is not easy. Some early blockchain projects failed because they rushed or made things too complicated. The lesson? Be patient, test often, and listen to everyone's concerns. Why does this matter? Because billing headaches do not just cause frustration. They delay care, waste money, and damage trust. Non-fungible tokens could bring transparency, speed, and control back to patients. Imagine owning your medical billing records, providers getting paid faster, and insurers reducing fraud. Some early projects, like those in India, are already showing promise. But of course, there are challenges: privacy laws, technology integration, patient education, and regulations to navigate. So what do non-fungible tokens in healthcare payments actually mean? They are digital tokens that represent bills or records, secure, traceable, and controlled by patients. Smart contracts can automate payments once services are confirmed, cutting down on errors and fraud. If you're a patient, provider, insurer, or policymaker, now is the time to get involved. This is not just technology hype. It is a real opportunity to fix one of healthcare's biggest pain points. Join the conversation, take the first step, and help shape the future of healthcare payments. Let us do this together.